Hello and welcome. This is Ritika Jhanji Jakriyani and you're watching the Health Summit 2022. The theme for this year's summit is Healthcare in India Vision 2022. In the Season 3 of Health Summit, eminent personalities from the field of healthcare, policymakers and doctors, some very prominent names from the field have come together to share their views on topics as diverse as health infrastructure in India, post-COVID healthcare, and very importantly, the rise of Ayush in India and how it is changing the Indian healthcare scenario. After the huge success of 2020 and 2021 health summits, this year we are taking this summit to the next level with the inclusion of policymakers and leading experts in the field of healthcare, health infrastructure, and just as I said, Ayush. The focus, ladies and gentlemen, of this summit is to actually disseminate some very serious information to you, but in a very viewer-friendly manner. We hope to bring together different players and bridge the gap that exists between the policymakers, healthcare industry players and patients so that we all have a clear understanding of the facilities that are available to us today and also what else needs to be done to make India the preferred destination for both modern and traditional medicine in the world. But before we do that and begin the summit, I would like to express our gratitude to our partners for associating with us, starting with our e-commerce partner, Amazon.in, our fitness partner, Samsung Galaxy Watch, special partners, GSK and MyBill Book, cooling partner, Blue Star, and associate partners, Apollo 27 and LG Purifiers. Thank you so much for partnering with us for this very special summit. And also, we have to really thank and express our gratitude to some of the very prominent personalities from the field of healthcare who've taken up time from the busy schedule to join us during the course of this summit, starting with Dr. K. Srinath Reddy, President, Public Health Foundation of India, Dr. Randeep Guleria, Director, AIIMS, Padma Shri Dr. Atul Kumar, Medical Director, AK Institute of Ophthalmology, Vaidya Rajesh Kotecha, Secretary, Ministry of Ayush, Dr. Subhash Kaushik, Director General, CCRH, Ministry of Ayush, Dr. Mahesh Vyas, Dean, All India Institute of Ayurveda, and many more. And ladies and gentlemen, our chief guest of the Health Summit is none other than the Honorable Union Health Minister, Dr. Mansukh Mandaviya. Thank you so much, Dr. Mansukh Mandaviya, for making time out from your schedule and joining us for the Health Summit. I request you to please open the summit with a few words.
नमस्कार। जी मीडिया के द HealthSite.com द्वारा हेल्थ केयर इन इंडिया विजन 2022 विषय पर इस डिजिटल हेल्थ समिट का आयोजन एक सराहनीय कदम है। इस तरह के आयोजन से हेल्थ केयर और इससे संबंधित विषयों को लेकर समाज में जागरूकता आती है। हेल्थ केयर सेक्टर में क्या क्या हो रहा है, इसकी जानकारी भी लोगों को मिलती है। हेल्थ केयर सेक्टर में आज किस तरह से काम हो रहे हैं, यह बताने के लिए मैं प्रधानमंत्री श्री नरेंद्र मोदी जी की एक बात से शुरुआत करना चाहूँगा। मोदी जी ने हेल्थ केयर को हमेशा टोटल अप्रोच के साथ देखा है। उन्होंने हेल्थ केयर को लेकर टोकन अप्रोच नहीं अपनाया। यही वजह है कि आज आप देखेंगे कि हेल्थ केयर सेक्टर में चौतरफा विकास आपको दिखाई दे रहा है। मुझे यह बताते हुए गर्व हो रहा है कि मोदी जी के नेतृत्व में आज हेल्थ इंफ्रास्ट्रक्चर को मजबूत करने के लिए जितना काम हो रहा है उतना पहले कभी नहीं हुआ था। कोरोना महामारी ने हमें सिखाया कि हमें अपने हेल्थ इंफ्रास्ट्रक्चर को और मजबूत करने की ज़रूरत है। कोरोना में केंद्र सरकार ECRP 1 और ECRP 2 पैकेज लेके आई। दोनों पैकेज को मिला के 38,000 करोड़ रुपए से अधिक खर्च करके केंद्र सरकार ने कोरोना के खिलाफ लड़ाई को हमेशा मजबूती दी और हेल्थ इंफ्रास्ट्रक्चर भी उसके साथ मजबूत हुआ। कोरोना के खिलाफ हमने जिस तरह से लड़ाई लड़ी और जिस तरह से दुनिया का सबसे बड़ा वैक्सीनेशन अभियान चलाया, उसकी तारीफ नहीं केवल भारत पर पूरी दुनिया में हो रही है। वैक्सीनेशन के लिए रजिस्ट्रेशन से लेकर एडमिनिस्ट्रेशन और सर्टिफिकेशन तक की पूरी प्रक्रिया भारत ने कोविन पोर्टल के जरिए चलाई। कोविन हमारे देश के डिजिटल इंफ्रास्ट्रक्चर की हमारी शक्ति दिखाई देता है। प्रधानमंत्री आयुष्मान भारत हेल्थ एंड इंफ्रास्ट्रक्चर मिशन के तहत 64,000 करोड़ रुपए से अधिक का निवेश देश के हेल्थ इंफ्रास्ट्रक्चर को मजबूत करने में आज किया जा रहा है। देश के हर जिले में तकरीबन 100 करोड़ रुपए का निवेश हो रहा है।
इवोल्यूशन ऑफ आयुर्वेदा के ऊपर बहुत बड़ी हेल्थ समिट कर रहा है और पर्पज है लोगों का योग, आयुर्वेद और नेचुरल चीज़ों की तरफ जो रुझान हुआ है कोरोना के बाद, और यह अब कंटिन्यू लोगों की एक जीवन शैली बन गया है। और ये इस समय के केवल भारतीय नहीं, पूरी दुनिया के लोगों की ज़रूरत है, क्योंकि जिस तरह से कम्युनिकेबल नॉन कम्युनिकेबल डिजीज़ बढ़ रही है, बीपी, शुगर, थायराइड, अस्थमा, आर्थराइटिस, कॉन्स्टिपेशन, कोलाइटिस, आईबीएस, और इसके साथ साथ ANA, HLB27, एवियन, RA फैक्टर, CRP लेवल लोगों का बढ़ रहा है, और जिनको ऑटोमेन डिजीज़ कहते हैं, इस तरफ करोड़ों लोगों की ज़िंदगियां नर्क बन रही हैं और लोगों के पास कोई परमानेंट या हम कहें कि सस्टेनेबल सॉल्यूशन नहीं है कि जो रोगों को जड़ों से मिटा सके। लोगों को 10, 20, 30 साल हो गए दवाइयों, अलग अलग बीमारियों की दवाइयाँ खाते खाते, और उन दवाओं से डिजीज़ कंट्रोल तो हो रही है लेकिन क्योर नहीं हो रही। एक तरफ ड्रग्स और ड्रग्स के एडवर्स इफेक्ट्स, दूसरी तरफ डिजीज़ और डिजीज़ की कॉम्प्लिकेशंस। एक ऐसा चक्रव्यूह है जिसमें इंसान पिसा जा रहा है। आखिर उसके सामने समाधान क्या है? तो आयुर्वेद, जो हमारी हजारों वर्षों पुरानी साइंस है, जो ऋग, ये जो अथर्ववेद से निकलती है, और महर्षि चरक, सुश्रुत, धन्वंतरी और जो सुषेण वैद्य हैं, अग्निवेश हैं, जो वक्त वक्त पर हमारे ऋषि मुनि हुए, उन्होंने हमें जो आयुर्वेद का बोध दिया। आज मैं देखता हूँ हमारे करीब 500 साइंटिस्ट हैं पतंजलि के अंदर, जो हजारों वर्ष पहले हमारे ऋषि मुनियों ने, चाहे वो अणु तेल था, चाहे वो महायोगराज गूगल है, चाहे वो कोई भी रस रसायन, भस्म, पिष्टि, चूर्ण, पाक, अवले, आसवरिष्ठ बनाए थे, उनका जब आज हम साइंटिफिक वैलिडेशन करते हैं तो हर पैरामीटर पर वो खरे पाते हैं। अर्थात जो भी हमारे पूर्वजों ने हमें आयुर्वेद का ज्ञान दिया वो ऑथेंटिक है, वो साइंटिफिक है, वो इफेक्टिव है, रिसर्च एंड एविडेंस बेस्ड है। लेकिन अब नई युग की भाषा में उसको पुनः परिभाषित करने की आवश्यकता है। जी डिजिटल ने जो प्रयास किया है कि आयुर्वेद की तरफ दोबारा से लोग लौटें, और इस तरफ खाली देश ही नहीं दुनिया के लोग लौटें, इस दिशा में हमें और पुरुषार्थ करने की आवश्यकता है। क्योंकि जब तक अपनी मूल प्रकृति और मूल संस्कृति से नहीं जुड़ेंगे तब तक रोगों को हम जड़मूल से नहीं मिटा पाएंगे। और मैंने तो पिछले 45 सालों से योग को खुद जिया है। 30 सालों से योग, आयुर्वेद, नेचुरोपैथी और जो होम रेमेडीज़ हैं, जो प्रकृति ने, परमेश्वर ने छोटी छोटी जड़ी बूटियाँ हमें दी हैं, इनसे बड़े बड़े रोगों का स्थायी समाधान हमने खुद खोजा है और लोगों ने उससे लाभ उठाया। मेरी बहुत बहुत शुभकामनाएँ जी डिजिटल की इस आयुर्वेद को दोबारा से पुनर्जीवित करने के पुरुषार्थ के लिए।
You're watching HealthSite.com Summit 2022, and it's time for us to dive into the very first session. But before we do that, we would like to thank our partners, starting with our e-commerce partner, Amazon.in, our fitness partner, Samsung Galaxy Watch, our special partners, GSK and MyBillBook, our cooling partner, Blue Star, associate partners, Apollo 27 and LG Purifiers. Thank you so much for associating with us. Now, moving on, Indian healthcare scenario has been constantly evolving over the past 2 years. While on one side, COVID-19 pandemic showed that India can actually live up to the demands of a health crisis, on the other side, it has also brought to light the glaring divide between the rural and the urban infrastructure as far as health is related in India. How do we actually come down to bridging this gap? This session will focus on the health infrastructure of India, digital transformation for healthcare, and of course, how can you forget the Ayushman Bharat digital health mission and the roadmap for achieving universal health coverage. I have with me to take the session forward a very, very esteemed panel. And the panelists will be diving into their decades of experience and responding to some very, very important questions. Starting with Dr. K. Srinath Reddy, President, Public Health Foundation of India. A very warm welcome to you, Dr. Reddy. We also have with us Dr. Randeep Guleria, Director of AIIMS, and someone who's been at the helm of India's premier medical institute all through the COVID pandemic. Thank you so much for joining us, Dr. Guleria.
Thank you. Thank you.
We have with us Padma Shri Dr. Atul Kumar, Medical Director, AK Institute of Ophthalmology. Thank you, Dr. Atul, for joining us today.
Thank you.
And we're also being joined by Dr. Ankur Fatarpekar, Director of Cath Lab, Interventional Cardiologist, Symbiosis Hospital, Mumbai Dadar. Thank you, Doctor, for joining us and making time out for the summit. So let's open the panel by first looking at where do we actually stand today. And to begin my questions, I would like to go across to Dr. Reddy. Dr. Reddy, COVID crisis brought to light so many limitations in public health in India. According to you, where do we stand today and what else needs to be done to strengthen the healthcare infrastructure in the country?
It's very clear from COVID, not only just for India, but for other countries as well, that unless you have an efficient, equitable, and empathetic health system functioning very reliably, even without a public health emergency in the steady state, we will not be able to mount a swift, strong, and sustained surge response when a public health emergency does arise. And we know that our health system has not been very strong, certainly not in all parts of the country. We have had deficiencies in infrastructure. We have had shortages in human resources, in numbers, and to some extent in skills. And we have also had disconnect during the pandemic as weak spots. Fortunately, I believe these have been recognized, and now there is a concerted response both to strengthen the infrastructure, raise the level of our human resources, and provide better connectivity between the levels of care as well as to those who are seeking care. So I think the lessons of COVID have been quite clearly registered and the response has begun. We'll have to hope that the resources that will flow into these initiatives will speed up the process rather than keep it on the slow roll.
Thank you for your response, Dr. Reddy. Let me bring this to you, Dr. Atul. Now, let's look at the government policies and regulations. Do you think that enough is being done to make India and its healthcare sector globally competitive?
The dynamic leadership of the Honorable Prime Minister and our Health Minister, who's doing so much of work, Honorable Mansukh Mandaviya. We have done a lot. We've got vaccines which are acceptable all over the world. You heard the when he said he used the vaccine Covet given him on himself. So our vaccines are actually world renowned now. And we had Bharat Biotech, the private health sector, which is led by husband-wife team. Dellas, who've done so well. Then we have the Covishield, also having done so well. And now even small eye hospitals, private centers. My colleagues from MD who are doing MD at AIIMS have small health centers and they have vaccine facilities. So I think the government's done remarkably well. Nobody expected the COVID to be so bad when it started in China due to, eating animals which are wild and normally animals which are not to be eaten. So there was this new virus which came in, and this new virus created havoc compared to the other countries which are still suffering. You can see China, there's a full lockdown in Shanghai right now. and they're actually overdoing it. People are barred from exiting from their houses. It's kind of a psychological impact on the patient. So India is doing extremely well, and just we are masking ourselves. We're getting the vaccines. The government is insisting we take our vaccines. The ministers and the health minister and the prime minister have been insisting to take the vaccine. He himself took it in the beginning when we were actually shirking, and then we realized the vaccines are really helpful. So vaccine with mask, India is doing great. Even the small, I see in my center and in AIMS when I was there for 40 years, till a superannuated, and now in the private sector as I'm continuing my work. And I'm seeing even the poor people, which I see, because I see all kinds of people. It's not only the rich. I see lots of poor people, and when you ask them about the vaccine, they just come forward right away. Yes, we've taken the vaccine. And can we take the booster before we get our next eye checkup? I said, sure, you go ahead, take it. So there's no like a non-masking group, a non-vaccine group. So they're all kind of wanting to take it. And there's a government initiative which has done. The kind of media which has been used to propagate the idea of
around it. Right.
Yes.
Thank you, Dr. Atul, for your answer. Moving on to Dr. Guleria. Dr. Guleria, you've been talking of equitable healthcare for all, even in remote rural areas. What do you think the government can do to make sure that this happens?
I think it's a very important issue because we have a little bit of a skewed, let's say, patient-doctor distribution. Large part of our population is in rural area, but the percentage of doctors in that area are still less. And we need to see how we can correct this. One, of course, is by giving incentives to people to start working in rural areas and being able to provide the necessary infrastructure that they need. But I think what COVID has taught us is that there is a lot that we can do by using technology, especially in the health sector. Whether it be using teleconsultation, telemedicine, we can reach out to people in rural area. And I think that will be a game changer, because even if you have a remote area where there is just a healthcare worker, he can now, using teleconsultation and telemedicine, consult a doctor in a tertiary care hospital and take the necessary advice when it comes to managing a patient. We've also seen this whole concept of eICUs. You can run an ICU or a critical care center remotely by having all the technology being there, and a doctor who may not be that properly trained as a critical care specialist still can manage patients who are sick by taking advice and showing all the data to a specialist in a tertiary care hospital who may be thousands of kilometers away. We can also use artificial intelligence, and I think that is going to be the future, because AI would help physicians in remote areas to interpret X-rays, to look at skin lesions, be able to diagnose that. It could be useful in many other areas, and that could assist in a better diagnosis in rural India, even if you have a shortage of healthcare workers. So I think we need to develop a comprehensive plan, which is already something that the government is doing, to see how we can provide equitable across the country in urban, rural areas, and also in remote parts where healthcare is difficult to sort of achieve.
Right. Thank you, Dr. Guleria, for that answer. Of course, digital transformation and the whole digital technology is really crucial for connecting a country with as big a diversity as India. Moving forward to Dr. Ankur here, who's a cardiologist joining us from Bombay. Dr. Ankur, dealing with heart disease of patients, now that needs an approach that involves multiple disciplines, that is very intensive resources-wise. As far as infrastructure in the country is concerned today, what is the current situation and what are your expectations from the government on this?
Right. So when we talk of congenital heart disease, there are two aspects of congenital heart disease. One is the prenatal aspect and the postnatal. That's when before the baby is born and after the baby is born. So the prenatal aspect involves timely referral, because we know 20 weeks is the period wherein the baby, if found to have complex congenital heart disease, baby can be aborted. So it's very important that we pick up all these complex diseases in the first 20 weeks. So timely referral and one good sonography, that's a level 2 sonography, wherein all these complex diseases can be picked up and accordingly treated is very important part. So training of manpower in terms of a good sonologist who can do this, and secondly, good is very important. So every district should have at least a single hospital which has all these kinds of infrastructure so that all these complex diseases can be picked up. The second thing is also what we are seeing commonly is there's a problem with the logistics. It becomes very difficult for people from rural areas to come to these district hospitals. So if the government can take care of the logistics in terms of transportation or whatever the transportation amount is, if it could be reimbursed. So that will help us in preventing these complex diseases, because it's a burden to the society as well as takes a lot of time and lot of money on the part of the parents and the relatives. So it's very important that we prevent it. The second aspect is postnatal. That's when once the baby is born, then we need to do certain things. Like it's very important to have these saturation probes, which are specially meant for small babies like neonates and all. So we must have seen during COVID, we have this saturation probes, but for a neonate, because the fingers are very small, they are specially designed saturation probes where if the oxygen saturation is low, then the primary healthcare worker, the ASHA worker, can refer these babies to the select hospital. So it's very important that we have the infrastructure in terms of equipment available to refer such babies once they are diagnosed. These primary care workers, so they need to know when to refer, what the heart rate is, what the respiratory rate of the baby is, what the saturation is, and depending on these aspects, red flagging and the referral is very important. Again, I come to the point that a good sonology is very important. So you might not have pediatric cardiologists in every district of the state or of the country. So it is important that the local cardiologists might have certain training in pediatric cardiology be roped in, and if at all they find any problems, they could refer to a bigger setup or a bigger metro hospital. That's one more thing. And pediatric cardiology is majorly pediatric cardiac surgery, because these complex cases require surgical intervention. So it's again very important that we have good cardiac surgeons who are trained in pediatrics, because training in pediatrics is one thing which might not be available easily. So state-of-art centers like we have Wadia Children's Hospital here in Mumbai, then they do good pediatric cardiology work, surgical work. So surgeons coming in, getting trained for 6 odd months and then going back to their district place so that they can take care of this aspect.
Dr. Reddy, one very important issue that came to light in the past 3 years of pandemic, it is the neglect of rural masses. What, according to you, can be done to bridge the urban-rural divide in the Indian healthcare sector? And where do you think we stand today as far as this divide is concerned?
Well, as far as primary healthcare, which is the absolute foundational basis of a good health system, is concerned, primary healthcare was part of the design of rural health services for a long time, but it was not adequately resourced. Secondly, even though the National Rural Health Mission did aim to provide services preferentially to rural areas, it did not really cover most of the needs. Only 15% of the needs of the healthcare were covered, because it was selective primary care, focusing on some aspects of maternal and child health and some infectious diseases. Now we recognize that there are many other health conditions that need to be looked after. That is the first thing. The second, of course, is even secondary care is required, and access to secondary and tertiary care will not happen unless there are good emergency services and good referral linkages, which are both bidirectional. You have to send a person who needs advanced care to the advanced care center, receive the person back, and provide continuity of care. And also now, as non-communicable diseases like cardiovascular disease and diabetes, chronic care, it is not acute episodic care. And previously, primary health care was mainly geared towards that. So I think we do require additional investment in infrastructure. We do need more human resources, possibly even double the number of auxiliary nurse midwives and ASHAs, because now they are not only looking after immunization and antenatal checkup and incentivization for referral to institutional delivery. Now they have to look after diabetes, they have to look after hypertension, they have to look after mental health, they have to look after many other conditions. And these are now growing also in rural areas. So I believe it is important that we promote effective primary care services, good linkages to secondary and tertiary care, and excellent emergency transport systems. But we can now, as Dr. Guleria said, take the strength of telemedicine and telehealth as well in order to provide even specialist care through guided management in rural settings.
And Dr. Ankur, when you talk of cardiology, so let me bring this to you, which of course needs a lot of technically advanced tools. So how do we bring these latest tools to rural patients in India? What has changed in the last decade and what still needs to be done? Dr. Atul, but we're just talking about, we're looking at the government to do all that it can to give boost to the healthcare sector, but the government can't do this alone. It needs some assistance from the private sector. So what do you think the private sector can do to boost health infrastructure in India?
I think it can help because I've seen both sides of it, the government side of it for 40 years. And now I'm just getting into the private sector and I'm seeing what's happening. And I realized a lot of my patients have followed me. Just because they're getting better medical care, they feel more satisfied with me.
Right.
For whatever reasons they are, because there's a professional touch to it, you're knowledgeable. So we have to train our nurses, we have to train our auxiliary health midwives, we've got to train people properly. So I think we've got enough manpower. And the government's doing a hell of a lot, quite a bit. And we can see that even people from small towns and villages come to me for checkups. So there is awareness. There's awareness about diabetes. And there's a lot of awareness about aging and retinal diseases. And because I'm an ophthalmologist, I see people from small towns and villages, close to Alwar, close to Hapur, Bulandshahr, and beyond places like Lucknow, very, very small towns. With the connectivity which is now available, they usually use the roads. So they say we have excellent connectivity thanks to the present day mobility which has been improved due to the better train systems, better roads, expressways which the government has constructed. They're traveling. Yesterday I had a patient close to Lucknow in Sitapur. He lives in a village to have a car. Everybody has a car now. And it's those days are gone when the villages people didn't have a car. So they have the roads and they have the cars and they move. They come to Delhi, get their treatment, go back. So not only that, they say there's good eye health care, because being an ophthalmologist, they say good eye health care at Sitapur, at Lucknow. And if they want very high, they want a third opinion, for expert opinion, they come to me. And I usually refer them back to the ophthalmologist, treating them close to their place of where they live, which is a small town or a village. But I give them their advice, what I feel. So people are very aware now. I think India has changed a lot. We should not kind of relegate ourselves as a third world country anymore. We're actually getting on to be a first world country. And people are very aware, they're very intelligent. For being intelligent, you don't need to have to be a big institution, it's fine. But they're intelligent, they know what they're doing. And they come and they know they've got some problem in the eye. As I'm again saying, it's the question of the eye which I deal with. So they come and get their cataracts done and they come and get their retina checkups done. They also know there's something called Kala Motia, which is glaucoma. They know something as Safed Motia, which is cataract. And they know they can get surgery done for it. And they're very aware of it. So I feel quite happy with the way things are going. And I don't see the government's not doing anything. It's doing quite a bit. And I'm quite satisfied with what's happening.
And you feel that over a period of time, you might be able to bridge the gap better?
I think so. I was thinking I'd like to do some outreach. I sent in the ophthalmic technician, like post him to a place which is very backward, in a place which really needs some, and they can screen the patients and they can, through a method of telemedicine, let me know what's happening. So there's certain diseases like just getting a glasses checkup, or getting some dry eye treatment, or getting some artificial tears, or telling the children to screen addicted to phone. Children know what's an iPad, they know what's a computer, so they know everything. So we just have to tell them. I tell them 1 hour you read, 10 minutes take a break. Then 1 hour you read. Looking at the screens is very damaging because long hours can be very bad. You got to be outdoor activities, because outdoor activities in Singapore have shown the screen shrinks and it decreases the progression of myopia. So right now I'm seeing a myopia pandemic in the country because everybody is, due to COVID, not going to school. So probably that's the reason. But now people have become, again, physical schools have opened up. It's very good. because the vaccines, the children are also getting the vaccine, which is the government initiative. And so things are improving. I think I can just send an outreach team and screen the patient. Whichever needs a treatment which requires a tertiary care hospital, they can always be referred to me or to any other center. I don't say to me, but to anybody or to a public hospital.
Moving on, let's talk about the Ayushman Bharat. And let me take my question to Dr. Guleria, because he's been talking so much about Ayushman Bharat as the game changer. Dr. Guleria, what are your expectations? And a lot actually depends on the proper implementation of the initiative. How do we make sure that it's properly implemented?
So in my mind, Ayushman Bharat is a big game changer. It has made a huge difference because of the two pillars that it has. One pillar, of course, is providing the free treatment for indoor patients, and that has helped a lot of people who are below the poverty line and were not able to get treatment, whether it be cardiac surgery or knee replacement surgery. My own feeling is that it needs to be expanded more to cover more and more of the population, so that we don't have a large number of people who are sort of left in between, and their expenditure then pushes them below the poverty line. The second important pillar, which also we sort of don't give that much of importance to, but it would become very important in the future, is the wellness centers which would come up, because they would really help in looking at non-communicable diseases and providing comprehensive care for patients who are going to have diseases which are going to be with them for their entire life. So how do disease? And I think there is a lot of push that we need to do in terms of preventive health. That is another area which there is a huge need to really focus on, because a large number of diseases, whether it be cancers, whether it be the end organ damage that we see in hypertension and diabetes, can be prevented by just aggressive awareness among the population and focus on preventive health. So I think Ayushman Bharat will be a game changer. It is expanding. Many states have adopted it for the entire population, and that itself has made a huge difference. So I think that Ayushman Bharat will make a big difference as far as healthcare in the country is concerned in the coming years.
While we are talking about so many trends and so many new technologies that are coming in, there's AI, we're talking about telemedicine. Dr. Reddy, if I was to ask you that according to you, which are the digital transformation trends that will shape healthcare in 2022, 2023, which are the ones you would like to really pin down?
In the immediate future, I would think it is technology-enabled primary healthcare providers providing a wide range of services, right from point-of-care diagnostics. In our own institution, our researchers have shown very clearly that nurse midwives in the state of Himachal Pradesh with handheld digital devices, support systems on them, could manage hypertension and diabetes over 18 months with a reduction of 15 millimeters of systolic blood pressure and 50 milligrams % of blood sugar very effectively. Now, these are the kind of innovations that we need to make sure reach every part of India, and certainly health and wellness centers now with additional staffing and a mid-level healthcare provider, provision of essential diagnostics can actually solve. And digital health will show its maximum impact rather than niche areas of application.
So let me take this forward to Dr. Atul. If you were to understand your specialization and how do we actually apply digital technology there, Dr. Atul, how viable it is to actually take digital technology in a country where still a large chunk of rural population does not have that much penetration of that kind of technology to get access to it. For example, how is it possible for you to take care of vision-related problems through digital technology?
I think we have a large population in the rural area and they don't have access, like you said.
Right.
So, latest modern day technology. So the first thing is we have to kind of educate them. So technology can be kind of a video-based call or an audio-based call. So we can have a kind of a communication with those people, and there can be a technician over there, and he can screen the patient and then fix up the appointment for a call with me or a video call, or sometimes you have a video call. I think that's better, or an audio call. And so they can discuss their problem. So the preliminary treatment, don't know what's the gravity of their problem of the eye disease. They may be suffering from very severe glaucoma, where they may be getting color halos. So once they're getting color halos, probably I'll tell them that you must rush to a tertiary center where you have the facility for glaucoma testing, eye pressure testing. But if there's a ophthalmic technician there, he can check the eye pressure there and let me know the finding. He can check the vision over there and give him glasses if he can. If the vision does not improve, it could be can be because of cataract, or you can ask for diabetes. If he's got diabetes for a certain duration, I would definitely say, because India has become the diabetic capital, and after COVID, as a close friend of mine, Anup Mishra, he's been telling me that diabetes has been affecting the pancreas, and he says that he's seeing more of diabetic patients. And when I refer him a diabetic patient for treatment, he says, I have no time. So what I'm trying to say is that diabetes is increasing, and so is diabetic retinopathy. So if somebody's got diabetes and he tells me on the phone that through telemedicine that he can't see, I definitely tell him that diabetes can affect your retina. So I'll ask him to please, and he doesn't know what, like to educate the people through tele-ophthalmology and treat the emergency treatment, give an emergency treatment. But ophthalmology, for me, I think you'll have to tell them the preliminary treatment, but they'll have to visit the doctor for getting a detailed checkup. Because the equipment is so much, it's not possible to put all the equipment there.
Thank you so much for that response, Doctor. Let me go across to Dr. Guleria now. Dr. Guleria, how has technology actually changed the way doctors are treating patients today? Can most of the illnesses be treated digitally to a large extent?
Well, I don't think I'd say that as a clinician that everything can be done digitally. But I think COVID-19 taught us that a large part of healthcare, especially when it comes to follow-up, can be done through teleconsultation and through the digital platform. And you can have data, you can have radiology, you can have even ECG and other parameters.
You know, one very big issue of why health infrastructure hasn't evolved the way it has is because the spend on health infrastructure has not been, let's say, what it is in countries like the US, where there is a lot more bigger allocation for healthcare, right? So do you think that that's one big reason why health infrastructure has not evolved? Where do we stand as far as that is concerned?
Well, there are two elements here. We need more money for health and more health for the money, which means that we need to actually spend more on health, on infrastructure, human resources, equipment and supplies, and actual delivery of care, and provide financial protection against healthcare expenditure through either tax-funded healthcare or through heavily subsidized public health insurance programs and employer-provided insurance. But ultimately, it is the total amount of public financing that really determines how well we are progressing towards universal health coverage. India has not been spending much over several years, and out-of-pocket expenditure for several decades was well above 70%. And even in the turn of the century, it was about close to 66%. But now, in the latest health accounts of 2017-18, which is the only one we have right now at the moment, the out-of-pocket expenditure has come down to 48.5%, which is pretty good in terms of reduction. But the World Bank and the World Health Organization say that you need to come below 20% if you want universal health coverage. We need to move in that direction by spending more. The total health expenditure, however, has come down. It's only 3.3%. Therefore, we need to have the overall health expenditure increase, and with the government having a larger share of that. We need to track both of these. One other element is important for people to understand. By people not seeking care because of financial barriers. So if you don't provide enough services, then also you artificially reduce out-of-pocket expenditure. So you also need to look at service coverage. So you need to look at service coverage and out-of-pocket expenditure. Fortunately, service coverage is now increasing because of the health and wellness centers, comprehensive primary health care, strengthening of district hospitals, strengthening of the public health surveillance system, and of course, investment in more tertiary care, spend a little more on human resources, particularly because if you have a lot of infrastructure without adequate numbers of well-trained human resources, it will be a carriage without wheels. So the next immediate priority is how do we train more nurses, more doctors, more allied health professionals, and how do we deploy them effectively so that all this infrastructure and public investment can be better utilized. But allocative efficiencies are also important. We need to focus much more on primary and secondary care, and that is where we'll get the maximum benefit for the maximum number of people. And therefore, we do need to spend more, but spend it well as we can.
Dr. Ankur, since we're talking about reforms, how can interventional cardiology spur healthcare reforms in India?
So it's difficult for an interventional cardiology to bring about a sea change, but when you group together, like there are societies, Cardiology Society of India, wherein it's a group of interventional cardiologists in the country. When the group comes in, the reach increases. So each person can contribute in a certain way, especially with telemedicine coming in a big way. There are brilliant apps which are available. So each cardiologist, if he thinks of giving at least a few hours in a week, like 2 to 3 hours, he can interpret those ECGs coming from a rural area, and timely care can then be administered. So it's very important that groups of cardiologists come together to deliver good healthcare, especially sitting in cities wherein you can you do something impactful for the rural areas. Second is training of manpower. So it's not only I spoke about the cardiac surgeon, the pediatric cardiac surgeon, the cardiologist, but there are the other people, the trained staff like the cardiac nurse who assists you in the angioplasty, or maybe the cardiac technician who's there handling the cath lab. So these are all important people because you are as good as your team is. So it is very important that that training of this manpower is taken.
All right, that's some really valuable insights being shared here. But before I let all the panelists go, I request each one of you to please share a very brief one-liner takeaway from this session for all the viewers, for their benefit who are watching you in the session right now. Starting with you, Dr. Reddy.
Our commitment to strengthen our health system should not fade away after COVID ends or COVID subsides into an endemic state. It should be a continued commitment, not only of the central government, but also of the state governments, because of the health expenditure comes from the states. So unless each of the states also raises their game, we will not as a country progress, and the disparities that exist now between the states must be bridged if we have to have a national picture of health and well-being.
Okay, Dr. Atul, your one-line wrap out.
So see, once you qualitatively you improve yourself, the kind of trained personnel we have. Trained personnel, the amount of machines, the number of machines are not important, but the machines have to be well utilized. It should not be rusting. So it's important that qualitatively improve ourselves as a country. So that's what I feel, that we have enough doctors. We don't need more doctors. So many more doctors, so many more. I think the nurses also, there should be some kind of device based. If you do well, then some kind of an incentive for a nurse for something. If she's doing well. So they should have a climate or an atmosphere around them where they can work well in small places. DGI, it's okay, but even in small towns, we should all have that urge to work well. It's not that we put in more money, but the money is going to be misused. And the more equipment you buy, the more it's going to be misused. So it's not important that. We've got to qualitatively improve ourselves. We're already moving correctly, and I feel that there's a great success lying ahead for India, thanks to the government and thanks to the private sector. The government sector, because the government is also feeling the private sector has a big role to play. COVID, the private sector did play a major role. So moving from the government to the private sector, now I'm seeing that there's going to be a big change.
Dr. Guleria, what would be your final takeaway for the session?
I'd say that we are really moving in the right direction. We need to really make healthcare accessible to everyone. We need to increase awareness. We need to invest not only in infrastructure, but in human resources, and we need to work in making healthcare affordable for all.
And Dr. Ankur, very briefly, if you were to sum it up, what are the last words you would like to leave with?
So it's difficult for an interventional cardiologist to bring about a sea change, but when you group together, like there are societies, Cardiology Society of India, wherein it's a group of interventional cardiologists in the country. When the group comes in, the reach increases. So each person can contribute in a certain way, especially with telemedicine coming in a big way. There are brilliant apps which are available. So each cardiologist, if he thinks of giving at least a few hours in a week, like 2 to 3 hours, he can interpret those ECGs coming from a rural area, and timely care can then be administered. So it's very important that groups of cardiologists come together to deliver good healthcare, especially sitting in cities wherein you can do something impactful for the rural areas. Second is training of manpower. So it's not only I spoke about the cardiac surgeon, the pediatric cardiac surgeon, the cardiologist, but there are the other people, the trained staff like the cardiac nurse who assists you in the angioplasty, or maybe the cardiac technician who's there handling the cath lab. So these are all important people because you are as good as your team is. So it is very important that that training of this manpower is taken.
And with that, we come to an end of this very, very informative session. Thank you so much to all the doctors for taking time out of their schedule and joining us, and deep diving into their experience and sharing some really, really valuable insights with us. Thank you so much for joining us for this session of the Health Summit. Welcome back. We're now moving on to the second session of the Health Summit 2022, which is on post-COVID healthcare. But before we get into a very, very deep discussion with our panelists, we would like to thank our partners, our e-commerce partner, Amazon.in, our fitness partner, Samsung Galaxy Watch, special partners, GSK and My Bill Book, cooling partner, Blue Star, associate partners, Apollo 24/7 and LG Purifies. Thank you so much for associating with us. Moving on with the session now. Now we are in the third year of COVID-19 pandemic and the end is still nowhere to be seen. But because of the government's initiative in vaccinating the citizens of the country, the death rate is very low in the current wave of the pandemic, but still people are getting infected. And the worrying factor is that many people who recovered from the first and the second and the third waves are still feeling the after effects of this infection. Though it is too early to come to any kind of conclusion, but many experts are saying that COVID-19 should be treated as a chronic disease like diabetes and hypertension. This is because this virus affects the body in different ways and causes different complications, which are often chronic, and we're still trying to get hold of understanding them. To throw more light on this very, very important issue, we have some very eminent personalities with us from the world of medicine. Starting with Dr. Randeep Guleria, Director AIMS, Dr. Ashok Jinghan, Chairman of Delhi Diabetes Research Center, and Dr. Tapaswini Pradhan, Senior Consultant, Head and Neck Oncosurgery in the Prastha Apollo Hospital, Delhi. Thank you so much for all the panelists for joining us today. Dr. Guleria, let me begin with you. You're somebody who's been at the helm of India's premier health institute throughout the waves of COVID. Are we staring at multiple pandemics of neglected medical issues because of COVID-19 pandemic?
Definitely. So we're looking at two things. One is this century, the last 22 years, has been a century of multiple outbreaks. We've had in the beginning SARS, we've had outbreaks of what we call bird flu, we've had outbreaks of Zika, we had a previous pandemic known as swine flu, H1N1, we've had outbreaks of Ebola, Zika virus, and therefore there have been multiple outbreaks which you've seen in the last 22 years, that is this century. And this is related to multiple factors, and I think we need to be cognizant of that and therefore develop strategies of how are we going to really move forward in the post-COVID era as far as these outbreaks are concerned. And it's related to more urbanization, it's related to climate change, it's related to encroachment into a lot of areas which were habitated by animals or birds. And it's also related to a lot of movement of population into urban areas and more crowding that is happening. If you look at all of these infections, MERS coronavirus, Zika, all of them, SARS for that matter, even COVID-19, has been in either birds or in animals, and they've jumped species. So we still have to start looking at the plan it in a holistic manner, we have to look at what we call One Health, not only the health of humans, but the health of the environment, the health of animals, the health of plant, and they're all interconnected. And that is something that is becoming more and more important right now. So that is one part. The second part is that we've also noticed in COVID that when we have such outbreaks, many illnesses and many diseases get neglected. And this is what happened during COVID. We had a setback for a large number of non-communicable diseases. Cancers, patients were reluctant to come to hospital and therefore their disease got advanced. Tuberculosis program did suffer. And we also saw a sort of delay in immunization. So we have to have a robust system which is able to manage outbreaks and make sure that the other illnesses also don't get neglected.
As you clearly pointed out, Dr. Guleria, that so many patients got scared of even going to hospitals and their medical condition went out of hand. So let me go across to Dr. Jhingan, who actually deals with a lot of diabetes patients. It is a condition that is really increased post-COVID. Dr. Ashok, now many people who recovered from COVID infection have been diagnosed with high blood sugar levels. What we need to understand from you is that, is this a temporary medical problem or is it something that's going to have long-term repercussions on a person's health?
In fact, there are two aspects of this problem. One is that those people who did not have a diabetes and once they had a COVID, during COVID, they had a high blood sugar levels. They were admitted with that and they were treated for the same. The reason being, two or three reasons are there. One is that the virus directly affects the beta cells of the pancreas. So it itself is an inflammatory disease. So those who earlier had a diabetes, they had a more chance to develop the problem because of a low immune response. And third is that the COVID infection itself causes a severe reaction in the body. And there was a so-called the storm also. And in that, the whole body's immune system, that means your response to the disease was less. So that was the situation when these people who did not have a high blood sugar before the onset of the COVID on them, so they had this thing. Right now, we have been following them. It's almost 6 months to 1 year. They are still having a high blood sugar levels, but we don't know how much time more it will take. But they are on a medication, but definitely dose of the medicine is very much reduced. On the other hand, those who already had a diabetes, in those patients, the diabetes became very high sugar levels. The 3 months blood sugar, HbA1c was very high. These people who earlier were on a medication like oral medication, they were all treated by insulin. And insulin injections, their sugar levels have come down. And they are right now on their old medicine. Some of them are very low dose of insulin. So your question is that this problem of a high blood sugar, this occurred in both the situation. Number one, those who did not have, and that's why a new name was given that is called the COVID diabetes. And those who already had a high blood sugar, in those cases, the sugar went very heavy and it was very high. So these patients needed insulin shots to control the blood sugar.
Thank you so much, Dr. Ashok, for answering that. Let me go across to Dr. Tapaswini now. Dr. Tapaswini, now in the current wave of pandemic, COVID infection manifests in the neck as throat problems, according to doctors. What are the neck and head complications of COVID-19, and can these complications turn into chronic health issues later on?
So with the 3 COVID waves gone, we've realized that this particular virus has a heterogeneous spectrum of clinical manifestations. There are patients who are asymptomatic and there are patients who develop severe disease state. Besides throatache that you just described, patients can manifest with loss of sensation of taste, olfaction, which is smell, and that can happen to the tune of around 45 to 60%. But then the good part of it is that most of them recover. That is 90% of them recover within a 3 months span of time. The other issues which can happen to patients are ear problems, where they can have hearing loss. They can also have what is called tinnitus, that's ringing sensation in the ear. vertigo, and worst is the facial palsy. Quite a good number of us, we heard how mucormycosis spread like a fire, but then this I would not say is actually directly related to the virus, but it's an aftermath of the treatment of the disease. Now, if we look at the other head and neck, that is issues pertaining to head and neck cancers, we find that these patients are more vulnerable. In fact, they are 2 times more susceptible to develop this particular infection because of this virus. And also the severity of the various symptoms that you see is 5-fold times higher, probably because of their immunocompromised state and because of the tumor, disease, or because of the treatment that they are undergoing. So the various complications that we see are something like a respiratory distress, that is called an acute respiratory distress syndrome. They can have myocardial infarction, they can have pulmonary embolism, or liver issues, liver injury, renal injury, and also something which is really disastrous, and that is multi-organ dysfunction and multi-organ failure. Now, when we talk about chronicity, there's been an Italian study which says 9 out of 10 patients who have suffered from COVID can have can have symptoms lingering even after the virus has cleared off from the system. And that's what we call as long haulers or long COVID. And what we get to see is a chronic expression of fatigue and easy fatigability or shortness of breath. So this virus is not just a respiratory virus, but it can produce, as we said, a multi-organ dysfunction. So when it becomes chronic, patients manifest with things like pulmonary fibrosis or venous arterial thromboembolism, cardiac thrombosis, stroke, GIT issues, gastrointestinal issues like diarrhea, nausea, vomiting, renal problems or endocrine status, endocrine issues like diabetes, and of course, something which is overbearing, and that's the neuropsychiatric issues where patients have depression or they are a lot anxious. So that's how the chronicity can manifest because of chronic infections. The chronic problems of the virus can manifest.
Sure. Thank you for answering that, Dr. Tapaswini. Dr. Guleria, what, according to you, are the long-term complications or chronic issues that COVID survivors are likely to face, and how can they be prevented? Like many doctors are saying that COVID, like if you're feeling after effects of COVID, this is being called the long COVID instead of just COVID.
So I think this is something that we're learning more and more as we move forward, what we call long COVID or a post-COVID sequelae. When we started off, we thought COVID was just like any other viral pneumonia, and it would become, once you became all right, you were totally okay. But people started realizing that even after they had of COVID, months after that, they still had some lingering complaints and ongoing symptoms. And now even after 1 to 2 years of having suffered from COVID, we have patients who continue to have symptoms. So there is definitely a group of patients who continue to have long COVID. And interestingly, some of them have had very, very mild COVID, but they still have features. The common features that we see are what we call chronic fatigue syndrome. They feel tired, their energy levels are low, they're not able to concentrate. They have what they call brain fog, that whenever they try and focus for some time, they're not able to do so and they want to rest or lie down for some time. Some patients have increase in their heart rate, tachycardia. There are patients who had organ dysfunction also. COVID caused lung damage and we had fibrosis in the lung. So many patients, saturation is borderline, and if they go to the toilet or go for a walk, they get breathless. Some have cardiac involvement also. And there are patients who continue to have sleep disturbances, insomnia. So there is a whole spectrum of long COVID that we're seeing. In majority of patients, it becomes all right, usually by the 3rd month.
Dr. Guleria, how to best take care of it?
Yes, so I think the best thing to do is to really gradually, some patients benefit a lot from yoga, having a good sleep hygiene, having a regular sleeping hours, sleep 7 to 8 hours per day, and also try and do some meditation. That helps. Multivitamins, vitamin D supplements also have been shown to be helpful. But like I said, We're still learning a lot about long COVID because it's still an evolving process. I don't think we have a precise drug which I could say that you take this medication and your COVID symptoms will go away.
As you clearly pointed out, Dr. Guleria, that so many patients got scared of even going to hospitals and their medical condition went out of hand. So let me go across to Dr. Jhingan, who actually deals with a lot of diabetes patients. It is a condition that is really increased post-COVID. Dr. Ashok, now many people who recovered from COVID infection have been diagnosed with high blood sugar levels. What we need to understand from you is this a temporary medical problem, or is it something that's going to have long-term repercussions on a person's health?
Right now, those people, those who have suffered from the COVID and have recovered, these all people or otherwise also, the best thing is that everybody should go for a regular exercise. Everybody must have a regular healthy diet. And number 3, right now, if they think that there is a uncontrolled diabetes or there is a problem of a high blood pressure, or if there is some compromised disease, immunocompromised disease, they must get treated for that, especially those people who are elderly people, those who have kidney problems, those who have a cardiovascular or a high blood pressure. They are the people who are more vulnerable to this type of the infection. So that's why the immunity, you see, you can think of all those immunity boosters which are available, but I think the best immunity will come from the good diet. I think healthy diet, fresh fruits, fresh vegetables help in the building the body immunity.
So like issues related to diabetes also got neglected during the past 2 years. Dr. Tapaswani, I'm sure the medical issues concerning neck and head, they were also neglected during the pandemic. What impact will this have in the immediate and in the distant future?
And we had difficulty in figuring out the lethality of this particular virus and also the heterogeneity in which this infection would manifest. So during the pandemic, we saw that a lot of resources were actually diverted for the treatment of the non-COVID, diverted from the treatment of non-COVID cases. Cancer patients, as I said, they had problems because there were diagnostic delays, there were lack of follow-ups, and also the treatments got delayed. I would not say that this was some sort of a neglect, but it actually happened because of the complexity of the situation that we were all going through. Because we did not know how this virus would behave in these patients, we had to change our treatment policies. A lot of patients who were actually to be operated had to be put to a non-operable treatment policy, like they had to undergo radiation or they had to undergo chemotherapy. Now, what would be the long-term impact of this variation in the treatment? Of course, that's for time to tell us. But yes, we did figure out that patients who could have had been treated much better, could have been treated early in the disease, who would have had a better outcome of the disease if the treatment had been instituted correctly, what we would have done in the pre-pandemic times, obviously the outcomes would have been much better. There were cancers where we had to follow a wait and watch policies, like the indolent cancers. Like thyroid cancers, the well-differentiated varieties are considered to be indolent, or there are certain salivary gland tumors. So all these patients had to wait for the treatment. And all over the world, we found that there were changes in the treatment guidelines from time to time. Patients were categorized into the high, intermediate, and the low risk groups. So the policies kept changing. So the high risk groups were obviously given more importance because of the gravity of the situation.
Sure. Thank you for answering that, Dr. Tapaswani. Dr. Guleria, what according to you are the long-term complications or chronic issues that COVID survivors are likely to face, and how can they be prevented? Like many doctors are saying that COVID, like if you're feeling after effects of COVID, this is being called the long COVID instead of just COVID.
So I think there are 4 or 5 lessons that we've learned. One is that we have to have an active surveillance system. We need to be able to pick up an outbreak early and develop strategies to contain it in that area itself. So surveillance, which is national, which is global, and data sharing, so that if you have an outbreak in your one state, we are able to make sure that it doesn't spread to other states. We did that when we had an outbreak of Nipah virus. So similarly, a surveillance system that is robust, which has centers which can do genome sequencing, pick up new variants, that is very, very important. The second important part is that we have to invest a lot in research for developing new drugs for the treatment of emerging infections, research for vaccination, which are broad spectrum, which can cover a large number of pathogens, and research for rapid point of care tests so that we are able to diagnose it quickly and therefore contain it from that point of view. So the second important pillar is going to be research. The third is to really invest in infrastructure and training. We realize that we really need to invest more in health, whether it be infrastructure, whether it's training healthcare hospital. We need to have infrastructure for infection control, infrastructure for isolation of these patients, and a robust mechanism so that if there's a surge in the number of cases, we are able to manage them. So that is the other very important pillar that we need to have. And then strategies for prevention and control. How do we increase public awareness so that people come forward, whether it be COVID appropriate behavior, whether it be hand hygiene or other things. That is the other strategy that we need to develop. So we need to develop a comprehensive program as we move forward, learning from what we sort of saw during COVID and making sure that we don't reach such a situation in the future.
So clearly the situation is a little scary because so many people are talking about post-COVID complications. Dr. Ashok, I would like to ask you that are we staring at a diabetes pandemic in India because of the neglect during the last 2 years, because everyone has been attending to COVID, and also because of COVID infection, and what often seen in all the three waves of situation?
I fully agree with you that every time the priority changes. In fact, this comes now under the heading of a cardiovascular and the diseases which are non-infectious diseases. And there are so many other problems also. Right now, we are the capital of diabetes in the world, and we are having a maximum number of diabetic patients, and it is predicted that by 2025, this number is going to be double. Not only that, right now, those people, about 10 to 14% is the incidence of diabetes. Equal number is of those who are pre-diabetic. That means this group of the patient will convert into diabetes. The incidence is 10% per year. So there is going to be a huge epidemic of diabetes. And I think the government has a limited resources. We have to agree that. So it's a private partnership which has to come into that, and they have to play. I can tell you that I have been organizing these diabetes camps right from 1999 in Talpura Garden, then in all the other places. Awareness has gone. Disease, if they will not get under checked, or if they will not go for regular testing, they will get complications like stroke, they will get a retinopathy, they will go for a heart problem, they will go for a kidney problem. And these all are multifold. Incidence is high multifold. That means stroke, if we talk, it's 5 times more common. The heart problems are 75% more common in diabetic. Kidney problems are 30 to 40% more common in diabetic. Similarly, the retinopathy, 3-in-1 will get a retinopathy in the diabetic, neuropathy. So these all are, but the best thing is, if you are aware, if you are able to keep your blood sugar under control, you can prevent all these complications. That's a good thing. So that's why I say awareness is the key to know about the diabetes. And once you know about the diabetes, then you can take a good control of your diabetes. So best thing is people, I think the media, the government machinery should all the time predict or project that, look here, if you are one of the person who fall in this high risk group of the patient who can get diabetes, like if you are overweight, if you are above 40, if you have a high blood pressure, if you have some heart problem, if your parents are diabetic, or if you during you had a gestational diabetes. So these are the people who are going to get, or PCOD girls, those girls who have a PCOD. So these are the persons who are going to get the diabetes. So once I know that I am in the high risk group, I'll go and get myself checked up. The second thing is most important, that symptoms. How one will know that I am a diabetic. So I think that if you know that if you go for a urination, if you are losing your weight, if you are having a more hunger, more appetite, and still you are losing weight, you are feeling lethargy, you are feeling tired, then you must get tested yourself. And the worst thing is, I'll say, that it's a silent killer. Many times there will be no symptom, and suddenly you go for a checkup and then you know, oh, you have a diabetes. So this is I would say, different ways of expression of this disease, and that's why we say it's a serious disease. So person should know about it, and then they can take care of that.
Dr. Taswini, I would like to come to you for a very specific question, because a lot of people are not aware that head and neck cancers constitute a third of the cancer burden in India. Is the current infrastructure adequate for treating patients with this kind of a complication in both rural and urban areas? What improvements, according to you, are needed here?
So we all realize that the whole healthcare system was not geared up for such a pandemic of such an enormity. But then it has come as a blessing in disguise, because it has exposed the various loopholes and gaps in the healthcare. And it has put a spotlight on the need for a medical revolution. Now, we are looking at a country which has a population of 1.4 billion, and a major chunk of our population, that's around 2/3, lives in the rural area. If you look at the medical infrastructure in the rural, we have around 3.2 government hospital beds for a population of around 10,000. And the range can be from 0.6 to 3.2, varying from different states. I don't think this is adequate. If you look at the urban sector, we have 8.5 hospital beds for 10,000 population, 8 physicians for a population of 10,000. And India has the largest working age population. If you look at the doctor to patient ratio, it's around 1:834. So all this said and done, the infrastructure is definitely not geared up for such a crisis. What we saw and what we all experienced was a chronic shortage of hospitals, hospital bed, ICUs, various equipments, shortage of gases, and also the doctors and the various paramedical staff. Now, if you look at the Fitch report, it says that 68% of our populace has limited access or even no access to basic essential medicines. And majority of our population, around 80%, doesn't even have a health insurance. So a lot of people did succumb to the disease because of economic crisis and lack of finances. But what came handy in the entire period is telemedicine. That, of course, worked beautifully, majorly in the urban sector, which helped the patient and the doctor connect to happen. So a lot of things which were not getting done because of the lockdowns, because of the commute restrictions, many things happened telephonically on video calls. We could resume certain, we could use our digital technology to our benefit, the Zoom and the Skype, that all came back again, and we could link ourselves to the patients. But unfortunately, this could not happen in the rural setup. One, not digital savvy. Second is the socioeconomic status. And third is the illiteracy. So reaching out to the rural population in this time of crisis was not really easy. So everything did suffer. Now, if you look at the malignancies and cancers, there were delay in the diagnosis, there were delay in screening, there were delay in the treatment because of various constraints. And a lot of things had to be restructured because of the situation, which actually made us do many changes in our treatment policies.
Gentlemen, we come to the end of this extremely informative session. I would like to thank all our panelists for sharing their valuable views with us and enlightening our viewers about the current health situation in India and helping us understand the post-COVID complications and how we can better take care of us. Thank you so much to all of you for joining us. Welcome back. You're watching session 3 of the Health Summit 2022. The session is on rise of Ayush and how it is changing the Indian healthcare scenario. But before we go any further, a quick thank you to our partners. Our e-commerce partner, Amazon.in, fitness partner, Samsung Galaxy Watch, special partners, GSK and MyBill Book, cooling partner, Blue Star, associate partners, Apollo 27 and LG Purifiers. Now, since time immemorial, the people of India have used traditional remedies to heal illnesses, both physical and mental. But these remedies have been mostly confined to a section of population and they were not embraced by all. But then came the National Rural Health Mission in 2005, which brought the concept of Ayush to the forefront. Since then, gradually, traditional healing practices have been gaining more momentum in our country, also in the minds of people. Today, the Government of India is actively promoting traditional therapies under Ayush, which stands for Ayurveda, Yoga, Unani, Siddha, and Homeopathy. And thanks to major initiatives by the government, this is not just being embraced by people in our country, but also by people from other countries. And one very, very important example of this is that of daughter of the former Kenyan Prime Minister, who actually regained her vision after undergoing Ayurvedic treatment in India. Yet, much more needs to be done to make these healing therapies even more popular. So in this session, we have some eminent personalities who will help us understand how do we actually spread more awareness about Ayush, change mindsets of people, and how do we actually bring in standardized quality control in Ayush products and a lot more. For this very session, we have with us Vaidya Rajesh Kotecha, Secretary Ministry of Ayush, Dr. Subhash Kaushik, Director General CCRH, Ministry of Ayush, Dr. Mahesh Vyas, Dean of All India Institute of Ayurveda, and Dr. Kushal Banerjee, Kalyan Banerjee Homeopathy Clinic. Thank you so much to all the panelists for joining us. To open this session, we have an introduction to the topic by Mr. Vaidya Rajesh Kotecha, Secretary Ministry of Ayush. Kotecha ji, please share your views on the rise of Ayush and how it is changing the Indian healthcare scenario.
I would start with that Ayush can play an important role in realizing the dream of New India by providing quality healthcare and medical care for its citizens. This is my first statement. At present, we are witnessing a highly receptive environment where the value of Ayush systems in healthcare is widely recognized and globally acclaimed for its holistic health approach. So when we talk about holistic, it's not just wellness, but it is also therapeutic care, disease treatment, or mitigation of pandemics. The strength of Ayush systems lies in preventive, promotive, or curative care. Diseases and health conditions related to women and children, non-communicable diseases, stress management, palliative care, rehabilitation, among others. We all know that when we talk about Ayush, Ayush has a different health systems, including Ayurveda, Yoga, Unani, Naturopathy, Homeopathy, Sovarikpa, Siddha systems. So, owing to its rich tradition of ancient practices such as Ayurveda and Yoga, India is one of the top destinations for holistic health treatments. When we look at the potential of Ayush, we also need to talk about research and development. So there is a kind of little misinformation. There are a lot of researches going on. There are a lot of evidences that I will be briefing the august audience. For example, we have central councils for research in all Ayush systems, and they have undertaken numerous research projects to establish the most scientific practices to clinical trials or preclinical work like in vivo in vitro trials. There were prestigious international collaborations in important fields like pharmacopoeia and several R&D and public healthcare initiatives, and that have been initiated by the Ministry of Ayush to harness the potential of Ayush system. For example, we have Ayush research portal, and that has been set up for disseminating this evidence-based research documentation of Ayush systems at global level. So when you type Ayush research portal, you can get on Google this particular web portal, and there are as on today, there are 34,886 research studies. Looking at the COVID initiatives, this is very recent. In the wake of COVID-19 pandemic, the Ministry of Ayush, through collaboration with interdisciplinary international and national organizations of repute like ICMR, CSIR, DBT, lot of different universities like BHU, KGMU, there are so many different institutes were onboarded, lot of medical colleges were onboarded. So through these initiatives, we were able to release National Clinical Management Protocol based on Ayurveda and Yoga for management of. So one can see that Ayush is having a lot of interaction, or there is a model of integrative healthcare or co-location through the mainstream health system also. For the quality parameters perspective, we are working with Quality Council of India through NABH accreditations, and we were able to launch different schemes, right from entry-level Ayush certification of hospitals and clinics to full-scale accreditation of Ayush hospitals and Panchkarma centers. We also have another vertical of Ayush Grid, where we embrace new technologies fostering innovations in healthcare. So this is kind of an IT backbone for entire Ayush sector. And main component of Ayush Grid are health, education, research, drug administration, medicinal plant and schemes management. The ministry has developed more than 15 IT initiatives or different projects and applications like Ayush-based health management information system, Ayush clinical case repository portal, yoga portal, Ayush Next application, Vibrek application, Ayush Sanjeevani application, Namaste Yoga application. There are so many. I want to also mention that we also have worked for WHO, and for WHO we have created AIM Yoga application for WHO, and now it is popularized through member state by WHO and across the world. So this is also another thing that we want to mention. As a part of Azadi Ka Amrit Mahotsav, we are celebrating by actively organizing various campaigns and initiatives. Through all these efforts, there is a tangible outcome. I want to talk about tangible outcome. What is the outcome? So in 2014, the market size of a manufacturing industry of Ayush was roughly $3 billion based on different studies. One of the CIA studies, there is a committee, Ved and Goyara committee. They also talked about $3.1 billion size of Ayush in 2014. Based on 2020 data, we have requested RIS to study about our manufacturing, and then we came out as a whooping 6 times growth, and we were able to know that the size actually in 2020 was $18.1 billion. So from $3 billion in 7 years, it went to 6 times growth of $18.1 billion, which is very, very highly encouraging, and it is very rare for our country to have such kind of growth. So, and there are 101 countries people came to India for studies of Ayush sciences, Ayurveda, Yoga and other sciences. We have also medical value travel initiatives by Heal in India. So we are working with Ministry of Health and Family Welfare. We have medical tourism destinations also. And recently Honorable Prime Minister also mentioned about Heal in India. So we are actually part of national strategy and roadmap for medical and wellness tourism. Ayush Ministry is also contributing a lot about this particular initiative. We also have champions and services where sector scheme where new age entrepreneurs can invest in Ayush, and they get a lot of benefits from Government of India in the form of interest subsidies. We all know that WHO DG came to India, and in the presence of WHO DG and Prime Minister of Mauritius, our Honorable Prime Minister has actually participated in the groundbreaking ceremony at Jamnagar on 19th April. So this center will be WHO's outpost in our country, and this is, I specifically want to mention that and this center aims to channel the potential of traditional medicine by integrating it with technological advancements and evidence-based research. This is GCTM, this global center, shall focus on 4 main strategic areas: evidence and learning, data and analytics, sustainability and equity, and innovation technology to optimize this contribution of traditional medicine to global health. It will emerge as an international hub for global wellness. I just mentioned about the Global Ayush Investment and Innovation Summit 2022. It was organized on 20th April to 22nd April in Gandhinagar, Gujarat. It was inaugurated by Honorable Prime Minister, and he has mentioned a lot of new initiatives of Government of India. For example, Honorable Prime Minister has announced a separate category of Ayush visa for medical value travel. He has also announced about Ayush mark for the quality products for the export sector. He also has announced the collaboration with BIS for ISO standards of Ayush products, and so on. So there are so many different announcements by Honorable Prime Minister. And through this summit, we were able to harness a commitment of 9,000 crore rupee investment in just 3 days from different categories like FMCG, medical value travel, services, pharmaceuticals, technology and diagnostics, farmers and agriculture, etc. So there were more than 70 MOUs were signed between different countries, prestigious institutes and farmer groups and industries. So this is the outcome of this just 3 days of a very big event. At the end, I want to mention some very interesting thing that through all these efforts, India prepares itself with renewed dedication and welcomes the world into this sublime realm of health and well-being, attracting investments and creating additional jobs. The government has set up a target of spending on healthcare from the current 1.3 to 3% of its GDP by 2022. And Ayush Ministry is also working towards strengthening the trade and industry sector in field of Ayush. As a matter of fact, as compared to 2014, in 2021, 22-23, we have got 5 times plus budget from Government of India for the Ministry of Ayush. So that is also showcasing the government's commitment of propagating Ayush as a public health or as a soft power of India to propagate into the world, and then scientific validation of Ayush sciences. Recently, we are working on Vision 2047, like when we turn 100. So as a matter of fact, Ayush Ministry is focusing on strengthening research and innovation in the field of herbal medicines. Ministry is committed to developing the Ayush sector with long-term growth of about 50 times by the year 2047 as compared to today. So we already have achieved 6 times growth in 7 years. So 50 times growth by 2047 is not a big goal. We'll be able to achieve it. At the end, Ayush is in a position to make India a global healthcare leader through its unique holistic healthcare approach. I'm sure the coming decade will also put an ever-increasing emphasis on Ayush systems of healthcare. Namaste. Thank you so much.
Thank you so much, Kotecha ji. That was very illuminating, very informative. Thank you so much for joining us. Now moving on, let me begin with Dr. Kaushik. Dr. Kaushik, how is Ayush industry slated to grow in terms of public health crisis? The Union government is very passionate about traditional remedies, but what exactly is being done to bring Ayush at par with modern medicine?
Okay. Recently, there has been a significant upsurge in awareness of preventive healthcare, especially during the present COVID-19 pandemic. Ayush industry, especially the nutraceutical sector, was a strong economic power. And the severity of this pandemic may have dropped by now, but nutraceuticals, let me confirm what is this. Any substance that is food or part of a food, which provides medical or health benefits, including the prevention and treatment of disease. So these nutraceuticals continue to be preferred. In a year-end report of the year 2021, according to Research and Information System for Developing Countries, that is RIS report, the Ayush market size has grown by 17%. Despite the slump in economic activities in 2020 due to pandemic, the Ayush industry is projected to reach $20.6 billion in 2021 and $23.3 billion in 2022. So India is considered nowadays the hub of alternative medicines like Ayurveda, Unani, Siddha and homeopathy. The market currently is experiencing a heave in demand of Ayush medicines in India, with increasing initiative by the government to support these systems and rising research and development. In September 2020, the Parliament of India passed 2 bills to improve access to quality and affordable medical education by ensuring the availability of adequate and high quality homeopathy and other Ayush medicines across the country. And now homeopathy industry is growing at the rate of 14% CAGR, that is compound annual growth rate, by 2027. So this is my take initially, and if need then I can do. When I was talking about nutraceuticals, so as report published in August 2020, the demand for honey has gone up to 45%, even that Chyawanprash by 85%, and the turmeric haldi by 40% in Ayurvedic store. Whereas the interest in these products has mostly been fueled by the recommendations from the Ministry of Ayush to fight COVID-19. Moreover, in August 2020, the Gujarat Health Department reported that they had distributed the homeopathic drug arsenic album 30 as prophylaxis treatment to approximately 3 crores and 40 lakh people, which is more than half of the Gujarat population since March 2020, after the COVID-19 outbreak. This medicine is cost effective and as comparison to other synthetic products. So the government of India is continually supporting the industry with investment in scientific research in Ayush, building the necessary infrastructure and regularly framework to regulate the system of medicine.
Dr. Mahesh Vyas, now Ayurveda is an important pillar of Ayush, but many people are still wary of this procedure, these ways of treatment. So what can be done to change the mindset of general public towards it?
The faith and acceptance of Ayurveda in the society has changed positively. Already the mindset of the people and their opinion regarding Ayurveda has changed very much during past few years, especially during the COVID time. When the whole world is struggling to search the substantial solution for this disease, despite having very good healthcare facility, it is the Ayurveda which has provided with very effective measures to deal with this health crisis so efficiently. This is the reason why India has the lowest mortality rate than rest of the other countries, because Indians extensively uses Ayurveda in their homes due to their faith in it. Now, the people has entirely different approach for this Ayurveda. The scenario regarding the belief on Ayurveda has now changed to very much extent. This is the reason why WHO has sanctioned $300 million for developing traditional system of medicine in India. We all have witnessed the landmark stone-breaking ceremony of Global Center for Traditional Medicine, a center that aims to harness the potential of traditional medicine. This will again help in promoting and popularizing Ayurveda in the society. But more is always less in context of advancement. There is indeed a lot more scope and possibilities to work for Ayurveda. We are already getting a very good and firm support from Government of India. This strength of Ayurveda can be popularized in the society with the help of conducting various awareness programs, camps, and government initiatives. The government institutions, government hospitals, educational and national institutions should work together towards creating awareness regarding the great system of medicine. Organizing various camps, exhibitions, and seminar will also help in this regard.
Dr. Kaushik, can you tell us something about Ayush Visa to get more people to visit India for Ayush treatment? What is being done to promote these therapies abroad?
Actually, this has been an initiative of the Ministry of Ayush along with the Ministry of External Affairs to facilitate Ayush treatment for people coming to India for taking medical treatment. Other than this special visa for medical treatment, if a foreigner falls sick in India, they can avail treatment under Ayush, both in indoor as well as in outdoor facilities. So because India is now famous for medical tourism, because of various factors such as high quality treatment, low cost and efficient medical staff. So India in recent years has emerged as a major hub for medical tourism and is now considered among the top 6 medical value travel destinations in the world. In a bid to boost medical tourism in India, our Honorable PM Narendra Modi ji has recently announced the launch of a special category of Ayush visa for tourists who want to visit India for medical treatment or tourism. This initiative is a part of the government Heal in India campaign to promote medical tourism in India.
Let me come to you, Dr. Kushal Banerjee, and talk specifically about homeopathy. What do you think is the future of homeopathy in India? And do you think that more government policies, regulations are needed to make it more popular? What kind of policies do you think should be introduced to make more and more people take to it?
So one very important thing to remember is that homeopathy was, although not discovered in India, it is the most popular in India. The highest number of patients and practitioners work and take medicines in India. So India has a very big responsibility in being the torchbearer of homeopathy for the rest of the world. The future, I believe, is extremely bright for homeopaths and people who take homeopathy for their illnesses in India and all over the world. But yes, there remains a lot to be done. I believe that the fund allocations and the resource allocations in the Ministry of Ayush should be equitable, reflecting these responsibilities that we have to the rest of the world and to the nation as the torchbearer of a system of medicine that needs this support. Second, it is important to set up establishments of excellence. We have a few, but we need more. These should lead the charge in terms of research and high quality replicable research and analysis, which will build faith amongst not only patients, but also practitioners of conventional medicine and other systems of medicines. In terms of policies that can be done, last mile improvement, trickle-down effect right down to the patient who may not have access to healthcare very easily needs to be improved. In government healthcare service delivery areas, there should be promotional activities, understanding and promoting homeopathy wherever it is relevant. Practitioners of other systems of medicine must be sensitized to what homeopathy can do and in what illnesses, so they can proactively promote it when they know their own system may not be that effective. This will also build a huge amount of confidence in the patient, knowing that a doctor is recommending homeopathy for some illnesses that his or her own system may not be so effective. These 2-3 areas, I believe, will go a long way in building a very strong evidence base and increasing popularity and trust in homeopathy amongst patients.
Dr. Vyas, when you're talking of policies, what do you think of the recent policies of the government regarding Ayurveda, and what can be done to make this healing therapy the first choice amongst the general public?
No doubt, Indian government has taken very strong and effective steps for this pathy, which was in actual sense was somewhere missing. We have now a separate ministry, that is Ministry of Ayush, which is now the main governing body for Ayush. Earlier it was under Ministry of Health and Family Welfare, but now it is a separate government body. The government of India, through this Ministry of Ayush, is involved in policy formulation, development and implementation of programs for the growth, development and propagation of Ayurveda. The government has also increased the fund of Ayurveda almost twice or thrice. This helps a lot in strengthening the Ayurveda. A step like Ayushman Bharat, Azadi Ka Amrit Mahotsav, startup challenges to promote Ayurveda entrepreneurship were some of such examples which has helped in promoting the Ayurveda amongst the masses. Global Summit of Traditional Medicine to establish Global Center is the landmark step in India in the presence of Director General of WHO, Dr. Tedros. It was such an overwhelming day for all of us. The ministry has identified its mission in terms of 7 broad areas of Ayush activities. These are information, education and communication, drug administration, human resource and development, medicinal plant research, international collaboration, etc. The information education and communication aspects deals with the publishing and popularizing the initiatives taken up by the government and even the private sector in perspective of development of Ayurveda. In the field of education, the Ministry of Ayush is striving to upgrade the level of value-based education concerning Ayurveda. The formation of NCISM, National Commission for Indian System of Medicine, is an important step as it will ensure availability of high-quality Ayurveda professionals in all parts of the country. The drug development and administration sector deals with the production of quality and safe Ayurveda pharmaceuticals. The reforms are made in field of cultivation of medicinal plant to ensure the availability of quality medicinal plant. This has also created immense opportunities for farmers, entrepreneurs and agriculture sectors. The establishment of various national institutions, government bodies like CCRS are motivated towards stable human resources and high quality research in field of Ayurveda. The international collaborations of Ministry of Ayush and institutions like All India Institute of Ayurveda with several countries across the globe are contributing to globalization of Ayurveda and providing an opportunity for foreign investment and economic progress. The population will surely choose Ayurveda as first choice of treatment with the increasing popularity and access to this system of medicine. Various Ayush clinics are being set up across the country in every village to render the Ayush services to concerned population.
Dr. Kaushik, we hear that a lot of people come to India from abroad for homeopathic treatment. Can you tell us why, when they can go to Germany where this treatment option enjoys a privileged legal status, what extras can we offer them?
Actually, it is true that homeopathy was born in Germany, but homeopathy has witnessed growth in true sense here in India only. India today boasts as the world leader of this science with a well-institutionalized homeopathic medical system, with more than 250 homeopathic medical colleges which are offering UG and PG, PhD education, having more than 3 lakh practitioners and having more than 260 hospitals and 8,000 plus homeopathic dispensary. And we have around 400 homeopathic drug manufacture units here in India itself. So moreover, homeopathy is a part of the primary healthcare delivery system of this country and enjoys its support from the government, and it is legally accepted. And we have separate Ministry of Ayush for promotion of homeopathy along with other Ayush systems, and which is very unique to this country. Various prime ministers advocated the use of homeopathy for treating the mother and child due to its efficacy in taking care of diseases in this age group. So therefore, the acceptance and demand for homeopathy in India is immense as compared to Germany or any country. Thank you.
Dr. Banerjee, the normal belief among people is that homeopathy works very slowly. Is this true? Which diseases are easiest to cure with homeopathy, and which ones people, should maybe, they take a little more time? Just share your views on that.
Right. So this is a common misconception that homeopathy takes a lot of time to work. This question has to be looked at in the context of the disease about which this question is being asked. Now, if there is a skin disease, for example, which does not have any cure in conventional medicine, even if the treatment lasts 5 years, 10 years, that is actually shorter than the rest of the patient's life. And that is the duration for which he or she would be taking conventional medicine just to manage the illness and not get rid of it. So there are these illnesses whose treatment may span really long periods of time, but ultimately, because there's a potential of getting cured, you can actually say that the period of treatment is shorter than the period under conventional medicine. But if someone is coming to us with a simple illness like a migraine, like recurrent headache, homeopathy is able to start giving relief within the first 5-10 minutes of ingestion of medicines. There are patients who are in ICU on ventilators, on other organ failure, complicated syndromes. and who are taking homeopathy and they are able to report improvement within minutes or hours of ingestion of medicine. Viral fevers cannot take, you cannot give medicines that will get you better 3 weeks later. So that's a common misconception. Homeopathy does not necessarily take time. It is extremely quick acting when it is required and depending on the illness. There are certain conditions, just like in any system of medicine, every system has its scope and limitations. So homeopathy also has its scope and its limitations. So in terms of limitations, I will say that in an acute emergency, for example, if someone is suspected of suffering a heart attack, at that time, it may be advisable to rush to a hospital instead of relying solely on homeopathy. Homeopathy, even at this point, can be thought of as an add-on or as an intermediary till you are able to reach the hospital or to reach a practitioner. In acute accidents where you have had multiple fractures and other issues that may be damaging the organs have got damaged, torn. In these conditions, you have to go to a healthcare center and be given conventional medicine and whatever mechanical help that needs to be done. But barring a few of these, I believe that homeopathy has a very wide scope, either as an exclusive mode of treatment or as an add-on mode of treatment. So in both these instances, I believe that homeopathic medicine brings immense benefit to the patients. So it's extremely important that even as an add-on or as an exclusive mode of treatment, homeopathy has huge benefits for the patients.
Dr. Vyas, are there any illnesses where you may recommend treatment with modern medicine while continuing with Ayurvedic treatment?
Ayurveda is itself a complete science that can provide holistic and complete care in almost every disease condition. However, integrated approach can be helped to benefit both the science of Ayurveda and modern medicine. Modern medicine is important in acute and emergency conditions. Similarly, the chronic conditions like diabetes, thyroid disorders, and hypertension also require the continuation of ongoing medicines along with the Ayurvedic line of medicine. It is also important in management of cancer-like conditions which requires integrated approach. Even in times of COVID pandemic, popularity of Ayurveda increased to a great extent due to preventive and promotive measures like consumption of Chyawanprash, Anu Tela, Sanshamni Vati, etc. Also, the surgical, pediatric, ophthalmological and ENT branches need the approach of modern medicine along with Ayurveda to provide complete relief. Ayurveda can prove to be a boon in management of chronic conditions like rheumatoid arthritis, inflammatory bowel syndrome, IBS, SLE, etc., where Ayurveda can provide effective treatment.
Dr. Banerjee, can patients go in for fusion treatment like Ayurveda with homeopathy and maybe allopathy with homeopathy, like a combination of two?
Right. It is absolutely possible to get fusion treatments or add-on treatments, as you refer to it in evidence-based medicine, where one system of medicine is added on with another system of medicine. There are no contraindications, there are no drug interactions that patients or other doctors need to worry about. And we often find that adding on homeopathy, for example, someone's blood sugar is not coming under control despite being on insulin and other medication for years. When homeopathy is added on, we see an improvement. In many instances during chemotherapy and other issues, we see a requirement of lesser sessions once homeopathy was added on for the patient's treatment. In non-responsive multi-organ dysfunction syndrome, something that we saw a lot of after COVID in serious cases of COVID, particularly in the Delta wave, adding on homeopathy along with the stabilizing aspects of conventional medicine, we saw extremely high rates of response given the seriousness of the condition. So homeopathy as an add-on treatment works extremely well, and it can sometimes may need to be done, mainly because someone who is, say, on anti-epileptics or on anti-hypertensive medicines for hypertension and epilepsy respectively, for years, that patient cannot be abruptly withdrawn from this medicine. So homeopathy is added on and then gradually weaning wherever possible is done. So it's absolutely possible to do add-on or fusion treatments, as we call it, with homeopathy and other systems of medicine. I would only suggest that there should be some understanding, some synchronization between the practitioners involved in the patient's care to bring about best outcomes in the patient. Because ultimately, it is the patient who needs to benefit. And we all need to work together to help the patient get better.
And a very, very important question, I would like to come to you, Dr. Subhash Kaushik, for this is the standardized quality control in Ayush, which is somewhere missing right now. What is the government doing for that? And what are the limitations of Ayurveda and of homeopathy?
India is the world's second largest exporter of Ayurveda and alternative medicine in the world, and is continually promoting its export interests. India's strong ancient knowledge on Ayush and well-developed supply chain network will help export market to grow due to an increase in demand from international markets. So Ministry of Ayush has paved the way for strengthening the quality of Ayurvedic and other Indian traditional medicine products globally, and also enhance export potential, especially to the US market. This has been achieved by the signing of a memorandum of understanding between the Pharmacopoeia Commission for Indian Medicine and Homeopathy and American Herbal Pharmacopoeia USA. Homeopathic Pharmacopoeia Laboratory HPL Ghaziabad was established in 1975 as a national laboratory for the purpose of laying down standards and testing for identify purity and quality of homeopathic medicines. This laboratory also functions as Central Drug Laboratory for the testing of homeopathic medicines under Rule 3A of the Drug and Cosmetic Act. The Department of Science and Technology has recognized this laboratory as a scientific and technological institute. The main objective and activities of this homeopathic pharmacopoeia laboratories are like laying down a standard for homeopathic drugs in India with publications of Homeopathic Pharmacopoeia of India, quality control laboratories for identity and quality of marketed drugs under different provisions of Drug and Cosmetic Acts and rules. Likewise, research in Ayush sector to validate the traditional knowledge in modern scientific developments. And like maintaining medicinal plant garden with preference to plant use in homeopathy, along with cultivation and identification of medicinal plant. So it is needless to say that many more Indian startups are exploring this ocean of opportunities and contribute to further growth. Ministry of Ayush has entered this MOU with a specific purpose of strengthening, promoting and developing standards in the field of Ayurveda and other Indian traditional system of medicine between the two countries based on equality and mutual benefits. The collaboration of efforts will go a long way in enhancing the export potential of the ASU and H, that is Ayurveda, Siddha, Unani and homeopathy drugs. While the sector has shown a strong export performance with the Ayush pharmaceutical sector being the flag bearer of the flourishing trade surplus, the attractiveness of the sector lies in fact that the trade potential largely underutilized. So strengthening of domestic standard subscription, ensuring traceability of value chain and formulating global standards with international standards bodies are some measures that may be required for confidence in brand Ayush globally. Honorable PM Modi ji has just recently talked about Ayush Mark. To promote the traditional medicine industry and give authenticity to quality Ayush products made in the country. And in the last, I just want to say a few limitations of Ayurveda and homeopathy are the policy to mainstream Ayush faces, the problem of inadequate raw drug supply, less number of Ayush health centers, capacity building, and creating public awareness of its efficacy. So in this area, more research is to be undertaken. Thank you.
It's been a very, very informative discussion, I must say, to all the panelists. And I really hope that after listening to these conversations and these views, more and more viewers take up traditional therapies wherever they can help them. Hope we can encourage and spread more awareness. Thank you to all the panelists for joining us today and sharing their experience and their insights with us. And with this, we also come to the end of the Health Summit 2022. But before we go, we would like to express our gratitude to our partners, our e-commerce partner, Amazon.in, fitness partner, Samsung Galaxy Watch, special partners, GSK and My Bill Book, cooling partner, Blue Star, Associate Partners, Apollo 24/7 and LG Purifiers. Thank you so much for associating with this summit and helping us make this a grand success. So with this, we come to the end of the summit, but we promise to come back with Health Summit 2023, which we know will be bigger and grander. So keep watching this space and stay safe, stay healthy.